State governments have intensified preparations for isolation centers in readiness for possible admission of COVID-19 patients as cases of the virus continues to rise in the country. Amidst the surging cases, the Ogun State government said it had no fewer than 260 bed spaces in the 4 isolation states. The Benue State Commissioner for Health and Human Services, Professor Joseph Umbia, says the state has 100 bed spaces and 50 beds as backup. And as the country's daily COVID-19 tally continues to rise, the Nigeria Center for Disease Control says 1,547 new infections were confirmed on Boxing Day. Giving an update on the pandemic, the agency reviewed in a post on Monday that the new cases were confirmed in 9 states and the Federal Capital Territory. They include FCT with 806 cases, Lagos 401 cases, Borno 166 cases, Oyo 78, Ogun 47. Osun 30, Ekiti 7, Katsina 7, Kano 4, and Jigawa 1. And joining me now for more on this development is a medical doctor, Dr. Obadeyi Olarinwaju. Good to have you join us, Dr. Olarinwaju.
Good afternoon. Good to be here.
So we're recording more cases. We've seen from the extreme, we've come from one end of recording as low as sometimes 30 cases. In the past months to now where we're recording over 2,000 cases. But there is no explanation yet if it's as a result of the Omicron variant. We also see that countries around the world are recording more cases. Talk to us about what is playing out here.
Okay, thank you very much. So basically, we are seeing more cases more because we are seeing cases of Omicron variant. The Omicron variant is one of the variants that has been discovered to be a mutation of the COVID-19 virus. It is the next variant that has been discovered, that was discovered in South Africa, I think a month ago. The problem now is that most of the cases we are seeing now are majorly Omicron cases. But in Nigeria here, we really do not test for which particular strain of the virus we are seeing. We just do tests for COVID-19, and then that's why we're not really saying if it is Omicron or Delta virus. But basically, it's more of the Omicron virus from the symptoms we've been seeing.
So vaccination is basically our only way out, because we see that people no longer adhere to the non-pharmaceutical protocols. But at the moment, we have plateaued at about 3.7%, I guess, in terms of full vaccination. Most countries will get to about 50%, 40% of their population before they start to witness the vaccine hesitancy. Why are we witnessing this very, very early on in our own vaccination process?
Basically, it's more of an issue with our vaccination process to start with. We are not really, people are not really coming out to get vaccinated to start with. We know initially when COVID started, people were having issues with believing the government if we really had COVID-19. However, now that majority of people have understood that yes, this is COVID-19, we also have an issue with people wanting to take the vaccine in the first place. So yes, basically we have a lot of people. I can tell you that most of the patients have been saying that have the new strain of COVID-19 have been unvaccinated. So yes, we still have a lot of people that are unvaccinated in our community to start with. So we definitely are not going to see a resistance to the vaccine. We are seeing more of people that are unvaccinated coming down with the virus in the first place.
How do we proceed? Because it is a very delicate issue for us as a country. No more vaccine, no more non-pharmaceutical protocols, apart from churches and religious places of worship, where that is being adhered to. But just generally, people don't do that anymore. We do not have enough vaccines. We're talking about booster shots at this moment. It does seem like we are at a crossroad. How should we proceed?
So basically, according to the NCDC, there are enough vaccines to go around for the citizens of the country. We just need people to come out to take the vaccines. I know for a fact that NCDC has enough vaccines to go around. The issue we are having is that we do not have enough people coming out to take the vaccines in the first place. Basically, we just need to continue encouraging people to come out to take the vaccines, encouraging people to continue with their preventive measures, wear face masks, social distancing, and all sorts. But majorly, we need people to take the vaccines. We are talking about booster shots. Majority of the Nigerians have not really completed their doses. Some have not even started. But even the booster shot confers some form of immunity if you collected the first 2 doses. So yes, vaccine goes a very long way in preventing and helping us fight against this particular strain of COVID-19 virus.
And we hope that we can continue to get people to the vaccination centers. We need everyone vaccinated. Thank you so much for talking to us, Dr. Obadeyi Olarinwaju.
Thank you. Thank you.